Good morning, all. I am Dr. L.S. Adarsh, Associate Professor and Consultant Physician working in JSS Medical College and Hospital, Mysore, Karnataka. Today, we are going to discuss about an important disease, that is hypertension. So, first of all, we should know what is the burden of hypertension in our country. So, hypertension is highly prevalent in our country. Of course, across the globe also it's highly prevalent. In India, if you take urban population, about 40 to 45% are hypertensive. That means if you take 100 people, so out of them, 140 will be having IBP. So if you take rural population, the percentage of hypertension is about 20 to 25%. The important thing here is among hypertension who are present in populations, many of them are undetected. That's why hypertension or IBP is what we call many times a silent killer. So many of the people who just roam around, they may be hypertensive. So hypertension is that's why it comes as a silent killer. So they don't know they are having IBP. They just roam around without having any awareness of whether they are hypertensive or not. That means patient may not have any symptoms. So many patients with IBP also may not have symptoms, particularly stage 1 and stage early stages of hypertension. They may not have any particular symptoms at all. So they may only land up in directly with complications into the hospital or emergency ward. So that's why all of us should, particularly public or popular community people, should have awareness about the disease, very common disease, that is hypertension. So what is hypertension actually? So hypertension is, so our heart is continuously pumping from birth till the last part of the life. Heart continues to push blood to every part of our body. That's the important work of our hearts. But whenever heart pumps blood to the largest vessel, that is aorta, so the pressure created, whatever, because of the flow in the blood vessels is called as blood pressure. The pressure exerted by the flow of the blood in the blood vessels to the wall of the blood vessels is called as blood pressure. Of course, normal blood pressure should be ideally 120 by 80 plus or minus 20. So when the blood pressure is repeatedly measured and found to be very high, that is usually more than 140 by 90 by a qualified person. So in repeated readings are high, then we take it as, or we diagnose the person is having hypertension. So as I told, hypertension is a silent killer. That means patient may not have any symptoms at all. So that's why the only solution for this is early detection is we should have screening of population. So we should, all of us, particularly all the people who are having more than 30 years of age, they should be screened periodically, once in a 6 months or once in a year at least. They should get screened. They should check their BP periodically, so that early detection is very important. Early detection is the only choice for us to prevent the complications. So that should be very well kept in mind. So don't depend on symptoms. Many patients may have symptoms like giddiness, fatigability, weakness, but none of them are not absolute or not needed for diagnosis. So that's why periodic checkup and regular monitoring is very important in early detection, so that optimum treatment is initiated and we can help to prevent the complications. Coming to complications of hypertension. Why do you worry about hypertension? So because hypertension is known to cause a lot of complications. So even though patient may not have symptoms, so eventually they end up in many complications which may be fatal. Many times they may be detrimental. They may cause death if not treated in time. So what are the complications coming from above? So hypertension is a risk factor for stroke. So very high BPs can cause bleed inside the brain. That's called as intracerebral bleed, or bleed inside the intracranial compartment, that may lead to severe stroke. Patient may end up in stroke with a variable level of consciousness. Patient may go into very big stroke or very massive stroke happens. Patient may not come back at all. That's called as hemorrhagic stroke. The bleed or hemorrhage happens inside the brain because of very high BP. Rupture of the blood vessels takes place. That is only in very high BP, uncorrected, uncontrolled hypertension. Or even otherwise also, hypertension is also a risk factor for blood clot. That is thrombosis. What we call as medically is thrombosis in the blood vessels of the brain. That will lead to ischemic stroke. Blood clot leading to portion of the brain undergoes death. That leads to again another type of stroke called as ischemic stroke. So hypertension is risk factor for both hemorrhagic stroke as well as ischemic stroke. So they may end up in various disabilities. The recovery from stroke is often variable. We cannot, once the brain tissue is damaged, so it's very difficult to predict the outcome. So some may partially recover, some may totally recover, or some may not recover, or some may die. So the eventual complications are very severe, and that may lead to morbidity, that may lead to severe morbidity and mortalities. So that's why the only solution for is to having a good control of BP, early detection, and optimum control to prevent these worst complications. That is the first complication is stroke. Second one is coming to heart, very important complication again. So hypertension is a risk factor for myocardial infarction. There is, so whenever the blood pressure is high, heart has to pump at higher pressures. So definitely the workload on the heart is increased because heart has to pump at against the higher pressure in the blood vessels. So heart undergoes enlargement. That's what we call left ventricular enlargement. So heart undergoes enlargement. The enlarged heart itself is a stress for heart again. So workload will be more. Again, it will enlarge. If you don't correct hypertension, heart goes on enlarging. Ultimately, it ends up in cardiac failure. So definitely, high BP or hypertension is a risk factor for cardiac failure, and it's also a risk factor for block in the coronary blood vessels. So that leads to myocardial infarction, what we call it as heart attack. Common people call. So definitely, hypertension is a risk factor for heart attacks or myocardial infarctions. So only way is, of course, to early detection and optimum management, optimum control will prevent these fatal complications. As I told earlier, even the myocardial infarction or cardiac failure may end up in a significant degree of morbidity and mortality. So to prevent this, we have to focus on optimal and regular medications to control blood pressure. Coming to next complication, there is retina over in the eyes, inside the eyes, the innermost layer of the eyes, retina. So blood vessels in the retina get lot of changes because of uncontrolled BP. So there will be retina. That's what we call it as retinopathy. So hypertensive retinopathy will happen. So that leads to variable symptoms, or it may not have any symptoms. Eventually, they may end up in damage, retinal damage, and that leads to retinal detachment and various complications, including loss of vision. So that's why all hypertension should have a regular checkup, even though they don't have symptoms. Even diabetics also, they should have regular eye checkup. At least once in a year, they should get a regular eye checkup to detect early stages of retinopathy. That's about complications in the eye. Then coming to kidney, very important, another important complication. Uncontrolled BP or hypertension lead to pressure, the changes in the inside the kidney that leads to kidney failure. So eventually, uncontrolled blood pressure will end up in chronic kidney disease, what we call as CKD. So the common man take it as renal failure, chronic renal failure. So both the kidneys will undergo failure. So they are unable to maintain the normal functions of the kidney. So they end up in uremia. Their blood reports, kidney function test goes on rising, creatinine all becomes gradually increased. They may eventually end up in dependent on dialysis, and later they may need transplantation also. So whatever, they all takes many years to not, this all complications will not take one or 2 days. It will take many years. They silently happens inside the body. Once the disease is very severe, they may manifest as some symptoms. By the time, unfortunately, most of the times, whatever the complications, they are not reversible. So most of the complications which are explained, they are not reversible. They cannot be changed back. So again, here also I emphasize focus on optimal control to prevent this complication, to reduce the chance of complications. That is very important. Even peripheral vascular disease, the blood vessels in the peripheral the limbs, lower limbs or peripheral parts of the body, they also get blocked because of high hypertension. So that may lead to various changes in like gangrenous changes and loss of limb, sometimes because of severe gangrene, that is amputation may be a final result. These are the important complications of hypertension. Then coming to prevention and then treatment. So coming to prevention, so a couple of words about prevention. So as I know, all of us should develop healthy habits to prevent hypertension. So first one is salt restricted diet. So unfortunately, most of our Indian diet has got high salt content. So all of us should reduce the salt intake to less than 2 gram per day. Less than 2 gram per day is the recommended dose. So minimize the salt, avoid unless excessive use of pickles, salt containing foods. That's the first point. Salt restricted diet is the first important component of the dietary modification. Second one is we should encourage high potassium diet like fruits and vegetables. So high potassium diet help to prevent the hypertension to some extent. So we should encourage high potassium diet, particularly fruits and vegetables. Then regular exercise is very important. Regular exercise, at least 30 minutes of aerobic activities like swimming, jogging, or fast walking or cycling. It's recommended at least 5 days a week. So regular exercise is very important. That helps to improve the cardiac reserve, cardiac functioning of the person, as well as improve the status of the blood vessels, so that blood pressure will be maintained. Then other bad habits like smoking should be stopped, alcohol should be discontinued. They are detrimental to it. They will add to the risk of hypertension. Definitely smoking, alcohol, so high fat content diet, excessive non-vegetarian consumption, all should be avoided. Then stress management is also very important. So we should minimize the stress, having comfortable, relaxed life, uh, regular exercises, yoga, meditations. Definitely they help to minimize the stress of an individual, thereby help to prevent as well as in the treatment of hypertension. Coming to treatment, but per se as such. So treatment again comprises of three steps. One is lifestyle modification. In that there are two important steps. One is diet. Already told, salt restricted diet. We should minimize the salt. Then encourage the potassium rich diet and avoid high fat content diet also. So saturated fat should be minimized. Then trans fat foods and junk food should be avoided. Then smoking definitely should be discontinued. Alcohol should be completely stopped. They all increase the risk of all complications in hypertensives. Then very important is exercise. Already told, the regular exercises should be recommended. Aerobic exercise for at least 30 minutes, minimum 30 minutes a day, depends upon the individual ability. And coming to medications, very important. So regular medication is very important. So you should take doctor self medication is very harmful. So nobody should go for self medication. You should take a consulted qualified doctor. So remember, it's not one diseases like hypertension, diabetes. There are lifetime diseases. So that is another reality patients should realize, because many people, even though they know that they are hypertension, they are reluctant to start medication because they think that once we start, we have to continue medication. But remember, definitely, once you are hypertensive confirmed by repeated readings by a qualified doctor, so that means you are continue to be hypertensive. So you need regular medication. So there is no harm in taking medications. So that is another misconception in many of the even educated people. So drugs will cause damage. These medications will cause problems for them. It's not the case. Whatever the medications, there are various types of medications for hypertension. Most of them they have been experimentally proven to be safe, and they are very efficacious. It depends upon the individual patient. Doctors will decide which drug, which combination will work for the particular patient. So definitely most of the drugs are very useful or very efficacious in controlling the BP, thereby preventing the complications and dangerous events. So all the people should realize that the importance of regular medications. So they should remove that misconception about the dangerous effects of drugs, which are actually not the fact. So frequent monitoring is very important. Taking some drug which is prescribed 5 years before, 3 years before, without regular follow-up, that's also no use, because as I told, patient may not have any symptoms. Their BP may be, their blood pressure may be very high. They may be not having any symptoms. So symptoms are not dependable in hypertension. So they should have regular follow-up at least once in 3 months. They should go to the qualified doctor, physician, and get BP checked. And accordingly, the modifications in the medications will be as guided by the doctor. That will help most of the patient to keep their blood pressure under control. Definitely, that will improve the quality of life as well as the preventing the deadliest complications. Imagine a person who's hypertensive, not worrying, or not interested, or not inclined to take 1 or 2 tablets per day. They may end up eventually a dangerous event like stroke, which he may not be able to recover, or even kidney failure, for which he may need dialysis. Very miserable for not only patient, even for family members. It becomes a burden. So that's why all people should really realize, should really become alert about the entity of hypertension, and they should know the importance of regular medications and frequent and periodic monitoring by the qualified doctor. That's very useful. And some of the other variants are, some people says, I am getting BP only when entering the doctor's room and I visit the hospital like that. Yeah, there is entity called white coat hypertension. But definitely that has to be monitored. So we cannot just leave it like that. So because patients many times to avoid medications, they tell these things. So we should confirm whether it is really white coat hypertension or really hypertension is existing. So for that we need to advise sometimes ambulatory blood pressure. There is a machine which continuously records BP without the knowledge of the patient. So we monitor the blood pressure for 24 to 48 hours, even when patient is at home or office or in the hospital. So without regarding of anything, patient will have a ambulatory blood pressure monitor. That's called ABPM, ambulatory blood pressure monitoring. That will help us to detect whether patient is having hypertension or is just a white coat hypertension. So that also a very useful assessment for the suspected white coat hypertension. So remember, once the repeated BP readings are found to be high and checked by doctor and confirmed diagnosis of hypertension is confirmed, so you should strictly adhere to the whatever instructions given by the or advice given by the doctor. So definitely, hypertension is a deadliest disease, as I told, silent killer, along with other diseases like lipids, high cholesterol values, diabetes. They will increase the risk further. So all of you should keep in mind that. So frequent checkup, even though you are not hypertensive, as age advances, the risk of hypertension increases. The family history of hypertension again increases the risk of hypertension. So periodic checkup that are present, the only solution is the periodic checkup and early detection is the very key of the diagnosis, early diagnosis and effective treatment to prevent the complications and to improve the quality of life. So all the people should realize that hypertension is not a disease to be worried if at all you are having regular medication and optimal control of blood pressure. So most of the time you will be free or you will be safe to avoid complications of hypertension. Thank you all.